Hi, I'm Dr. Deanna Paulk, and I am coming to you representing Birmingham Anxiety and Trauma Therapy. We are located in Vestavia Hills, Alabama, right off Highway 31. Super easy to get to. Today we're going to talk about something called an FTD journal. It's something that I often have people do who come to me for therapy. Often when people come in and I ask them to describe how they're feeling, they tell me they're experiencing a whirl of a lot of different emotions that is really actually very difficult for them to describe. So what I usually have them do, I recommend that they get a little pad of paper about this big, and they start to do what I call an FTD journal. It's really not a lot of writing, so maybe it should be called an FTD chart. Nevertheless, I want people to chart about 4 times a day what I call an FTD. F equals feelings, T equals thinking, and D equals doing. All right, so for F, this is what a chart might look like. F equals anxious equals 4, right? I always want a scale of 0 to 10 in terms of how intense that feeling is. T equals thinking. So it would look like T equals, I don't know when I'm ever going to get out of this mess. And then D equals doing, and that is exactly what you were doing right before you started to write down and chart this FTD, all right? Do that about 4 times a day. Remember, F equals feeling, T equals thinking, and D equals doing. And give me a scale of how intense you're feeling. What will happen over the course of a week is that you'll start to recognize certain patterns that are associated in the way you're thinking and how that influences your feeling and vice versa. Then that's going to give you an idea of where to start to intervene to address this anxiety. Now, it may also reveal to you that you might benefit from some professional help in deciphering your FTD journal. If that's the case, that's okay too. So remember, chart your feelings with an FTD about 4 times a day. It'll do you good.